Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about human rights and government policy. We have a COVID-19 update from British Columbia with Bonnie Henry and Adrian Dix. They're going to tell us about the next steps, and there's some warnings out there, like choir practices and some family gatherings have caused outbreaks, and there's going to be some warnings about that in Dr. Bonnie Henry's message. There is an outbreak in a long-term healthcare facility, Maple Hill in Langley, BC. It is a Fraser Health facility, and which means it's provincially owned. So we have to be careful in how we're interacting with each other and making sure that if we're going to be taking like those really deep inhales and outhales, like for singing, exercise, things like that, that we got to add that extra space in there, or in some instances with choir practice and church singing, we might not be able to do that right now. But listen to what Dr. Bonnie Henry has to say, and Adrian Dix is about to introduce her in the next message here.
Good afternoon. My name's Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our BC COVID-19 briefing for Tuesday, June 16th, 2020. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations and people, and honored to be here. And with that, I want to say a couple of things about the schedule for the coming week. Tomorrow, Wednesday, we'll be providing a written statement on issues such as cases and outbreaks and so on. On Thursday, there will be an in-person briefing right here in Vancouver with Dr. Henry and myself. On Friday, there'll be a further written briefing. On Monday, we'll be back in Victoria at 3 o'clock, and at that time, Dr. Henry will be presenting some updated modeling on next Monday at 3 o'clock. With that, I'm honored to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So this is our COVID-19 update for June 16th. Today we have had 11 new cases, 10 who have been tested positive, and 1 epidemiologically linked case, bringing our total in BC to 2,756 people with COVID-19. 940 people are in the Vancouver Coastal Health Region, 1,426 in the I'm going to check that number. In the Fraser Health Region, 130 on the Vancouver Island Health Region, and 195 in the Interior Health Region, and 65 people in Northern Health. We have 1 new healthcare outbreak to report today, and that's the Maple Hill Long-Term Care Facility at Langley Memorial Hospital. That leaves us with 5 active outbreaks in the healthcare system, and we are now up to 579 cases, including 357 residents and 222 staff who have tested positive in our acute care system. We continue to monitor and support at the 5 locations that we have active outbreaks in the community. So we now have 172 active cases, of whom 11 are in hospital at the moment, with 5 people in critical care or ICU. There are no new deaths to announce today, and 2,416 people have fully recovered here in BC. As you know, we are gradually continuing to ease restrictions, and our objective as we move into these phases of our restart here in BC is to keep our cases of COVID-19 low and to make sure that we slow any growth in our communities. To do this, we have been and will continue to open what is safe to open and keeping closed those things that are more risky. We know that closed spaces, particularly closed spaces with poor ventilation, close contact, particularly if it's over a period of time, and crowds are the higher risk. So things that involve these will continue to have restrictions in the coming months. We are being thoughtful and measured in our response, and we're adapting as we go. It is a gradual transition, and we're slowly turning up the dimmer switch as we learn to adapt at each of the stages that we're going through. There are many things that we can do safely and that we continue to do, and we've learned along the way how to do that. We were able to keep grocery stores and pharmacies and other essential businesses going, and we worked through how to do that. We figured out our safe distances, the things that we needed to put in place to reduce constriction within facilities, within stores. We used our small numbers. We used masks when we couldn't maintain those distances. Once we flattened our curve, we started to open up more of our retail stores, restaurants, and then we adding back the surgeries and other things in our healthcare system. And then we moved into the transition of some return to in-classroom teaching in our schools so that we could learn how to do that and how to adapt in that system as well. We've since modified and expanded our options for restaurants to take advantage of things like our summer months and the patios and to support further reopening with things like engineering controls, like barriers in place, smaller groups that keep both the groups and the servers and the people who work in restaurants safe. Looking ahead, we're going to transition to developing these guidance for more things like spas, resorts, activities like recreational sports, and we're working to be able to safely restart other parts of our economy. And we're developing the tools in partnership with the BC CDC and with WorkSafe BC to be able to do this, and to all of us to understand how we can use our foundations to continue to make it safe. So businesses and the ones that have opened are learning that these layers of protection are what we need to safely operate, to protect ourselves, our employees, our customers, and all of our businesses. What also stays the same throughout this pandemic, however, are the personal measures that we have learned and that we'll need to keep following to keep ourselves, our communities, and our families safe. Frequently washing our hands, always staying home when we're ill, maintaining our safe distances as much as possible, the whole concept of fewer faces and bigger spaces, keeping our contacts low, especially if we have people in our household who are at risk of having severe illness from this disease. We know that these are our foundations for our protection and for our path forward, and closed spaces, close contact, and crowds are riskier for all of us. That's why things like family gatherings, either at a home, at a nightclub, or even choir practices, where people are inside and close together for an extended period of time, significantly increase the risk of transmission. And then we risk bringing that into our families, into our workplaces, and spreading it in our communities. We will have the opportunity to do these things again, but just not now. This is not the time to take those risks. It is far easier to maintain a safe physical distance from 4 people than from 40, and those are the things that we need to think about now. It is also much faster for us in public health to do the contact tracing we need to keep suppressing this virus in our communities when there are only a few locations to monitor and fewer people to alert when we have an increased risk. It only takes one person in a crowded setting to spread it to many others, and we have seen that around the world, but we've also seen it here in our communities in BC, whether it's a long-term care home, whether it's a group of people, a family gathering, whether it's a restaurant where employees are together, whether it's a workplace like some of our meat processing plants, for example. Our most effective way to manage COVID-19 in our communities is to continue to work together, to take care of each other, and to do our part. This is not forever, but it is certainly for now. Until we have the tools to fully stop this virus, we need to continue to take these measures as our foundation, and we need to continue to do this together, to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. Obviously, we're pleased and gratified that no one has passed away in the last 24 hours from COVID-19. Indeed, for the last 4 days. This is always good news, but we think of those who have struggled with COVID-19, those who are struggling with the impacts of COVID-19, including people in our care homes and those that work there, those that live there. And so on behalf of all of us in government, we want to acknowledge the 168 people who have passed away from COVID-19 since the beginning of the pandemic, and the grief and the sorrow their families must be feeling, and to say that we continue to be with them in all of the actions that we take. I wanted to just bring you up to date on a couple of things and speak about developments with respect to PPE. Just to note that there are 11 people in hospital from COVID-19 right now. If you remember, at the beginning of April, that number was 149. That there are 5 people in critical care. I believe that's down from what was 72. So in objective terms, there is improvement that we see, and that improvement is due to the actions of everyone in British Columbia. But COVID-19 is still around. We see it in new cases, and indeed today we see it in a new outbreak. I wanted to note that people are also returning to the healthcare system in significant numbers. That yesterday 5,548 people visited emergency rooms across BC, which is the second highest number since the beginning of the declaration of the pandemic. We often compare it as a baseline to March the 9th, when 6,500 people visited emergency rooms, to put it in context. And indeed, in one health authority, the Vancouver Island Health Authority, or Island Health, the numbers were significantly above what they were on March 9th, 1,095. Yesterday, 964 on March the 9th. Just to put it in context, that people are returning, and the activities of the healthcare system, whether it be surgeries, where we showed 5,900 surgeries have been done as of in the previous week in our last report on Thursday, or all these other areas, there's certainly significant activity now in the healthcare system beyond COVID-19. As I've done for several weeks now, I'd like to provide you an update on PPE in BC. In addition to this weekly update we've received, I also want to speak to our preparedness for pandemics generally, and how we're both replenishing our PPE inventory for both current and anticipated needs, and for our pandemic stockpile. This is going to take a little bit, and there's going to be lots of numbers, so I apologize for that in advance. As with previous weeks, I want to report on what has arrived cumulatively up to this time since the beginning of our reports. And to recap those cumulative totals, from the end of March to last week's report on Monday, June the 8th, the following PPE has arrived in BC. 5,500,000 N95 or equivalent respirators, over 9 million surgical or procedure masks, just over 2 million pieces of eye protection, including goggles and face shields, over 40 million pairs of gloves, over 2 million gowns. Today, I can tell you that over the last week, since my last update on Monday, June the 8th, until yesterday, we've received the following: 390 N95 or equivalent respirators, 1,825,750 surgical or procedure masks, 251,280 pieces of eye protection, 1,046,750 pairs of gloves, 447,420 gowns. We continue to work hard to increase our PPE inventory. We continue to pursue leads with new vendors and manufacturers. We continue to work with supply chain experts to make sure we're dealing with the right vendors and getting quality PPE. And we do this for 2 reasons. We need to ensure we have enough safe and effective PPE to protect our healthcare workers, patients, and visitors as we ramp up health services and elective surgeries in the weeks and months ahead. And we need to ensure we're rebuilding our strategic reserve of PPE that will prepare us for a potential second wave of COVID-19 or another pandemic in the future. Based on our BC experience with COVID-19 and from learning from other jurisdictions around the world, we have a much better understanding of how we need to prepare. We know more about how COVID-19 is transmitted and of the measures we can put in place to slow its spread. We also know that PPE is a key line of defense to making sure our healthcare workers and their patients are safe in situations where, of course, testing and care for COVID-19 patients is impossible from 2 meters away. Like most jurisdictions, BC maintained prior to COVID-19 an emergency stockpile of PPE. We kept 2 main inventories. We kept a base level of inventory that kept pace with our fairly predictable demand for PPE within the healthcare system under normal or non-pandemic circumstances, and we also kept a stockpile of pandemic supplies, including PPE, that was kept separate from our regular working inventory to keep us ahead of the game if a pandemic hit. Well, a pandemic did hit us, and our pandemic supplies and PPE were there as a safety net. When supply chains were disrupted to the extent that they were in March, our pandemic stockpile filled the gap, allowing us to quickly focus on procuring more PPE, both from traditional and non-traditional international suppliers. When COVID-19 hit BC, the Provincial Health Services Authority held a special pandemic inventory that included just under 2 million surgical or procedure masks, over 300,000 N95 respirators, over 150,000 gowns, over 2,500,000 pairs of gloves, and this was in fact essential. It was essential to have this float to carry us through some very difficult times in terms of global supply chains for PPE. But we also know now that we would have liked to have had an even more comfortable buffer. For example, during the period from March 15th to April 4th, our health system was using an average of approximately 12,000 N95 respirators every day. By contrast, prior to COVID-19, the health system was using approximately 1,800 per day. That's a 567% increase in daily usage of N95 respirators. And that level of usage took place over a period of time when we had greatly reduced occupancy in our acute care hospitals as we made the very difficult decisions required to prepare our system and protect our healthcare workers and open up beds for a potential influx of COVID-19 admissions. It was a very significant increase in usage, and similar increases occurred for other items of PPE. To put the situation into context, the 308,000 N95 respirators we held in our pandemic supply would last at that level of demand weeks. By contrast, prior to COVID-19, that pandemic supply would have lasted for months. Well, we fared fairly well in terms of keeping pace with PPE needs in our healthcare system. We've definitely learned from our experience. We need to prepare for the potential that supply chains freeze up again. We need to keep working to ensure we have a PPE backstop. We need to stock up. We need to look at opportunities for made in BC PPE, and we need to build our capacity to assess and test PPE. We're doing all of those things. We're working with supply chain experts to make sure we have a steady stream of PPE, and we're establishing a PPE testing laboratory in Vancouver that will make sure that respirators and other pieces of PPE meet or exceed standards around safety and effectiveness. On the topic of preparedness, I'd like to also mention how important it has been that well before COVID-19, we prepared and ran exercises to test our capacity to deal with pandemics. And this is a tribute to our health officers across British Columbia. Well before COVID-19, all health authorities had a pandemic plan in place and regularly participated in exercises. For example, over the past 2 years, Interior Health and Northern Health conducted pandemic-related exercises several times throughout 2018 and had a pandemic exercise plan for early 2020, which was obviously postponed due to COVID-19. The Lower Mainland Health Emergency Management Team hosted internal exercises with Vancouver Coastal Health, Fraser Health, medical health officers, and emergency health officers at least once a year, and participated in Canadian community-based exercises with municipal and industry partners. And just yesterday, in addition to exercises over the past 2 years, Island Health conducted a COVID-19 Wave 2 exercise to develop more robust preparedness and discuss lessons learned. Much more information on our preparedness, including BC's Provincial Pandemic Coordination Plan, which was refreshed in February 2020, is available at gov.bc.ca under Pandemic Preparedness. There are a suite of plans and protocols in place, and they're all available online. These plans evolve based on learnings and experiences such as H1N1 and through the leadership of the provincial health officer. They have served us well, and we're already coordinating across the health system to capture lessons learned with the aim of continued quality improvement and preparedness. Pour conclure, aujourd'hui, nous annonçons 11 nouveaux cas qui ont testé positif pour COVID-19 pour un total de 2756 cas en Colombie-Britannique. Il n'y a eu aucun nouveau décès lié au COVID-19 pour un total de 168 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 11 personnes sont actuellement hospitalisées, dont 5 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. À ce jour, 2416 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. And before we take questions, a few reminders for the media on the phone. Please press *1 to line up for questions. Media will be limited to one question only, and please keep your phones unmuted. You will not be heard unless I call your name. The first question is from Keith Baldry, Global News. Keith, go ahead, please.
Question, Dr. Henry, Minister Dix. Minister Dix, your reference to that huge spike in usage of N95 masks at a time when there was relatively fewer people actually in hospital. What accounts for that? Was it because people weren't sure exactly what the virus was doing at that point?
It absolutely was about concerns around the world about how this virus was being transmitted. In Canada, the WHO, and here in BC, the recommendations for providing care to people with COVID-19 was to use a level 3 surgical mask and eye protection and droplet precautions, we call it. But there was a lot of concern, and understandably, about how it could be transmitted potentially through what we call aerosols. And so there was a very high usage for anybody who had a respiratory illness, in particular of respirators across the system. Now as well, at that time we were in influenza season, so there was a lot of people who were coming to emergency departments, who were coming to our healthcare system with respiratory illness. So the turnover was very high. And we, as you might recall, we developed a protocol based on ethical principles about scarcity of PPE and how we would manage it. And when we started to implement that protocol, we made sure that it was the appropriate things were there for people who needed them, for doing what we call aerosol generating medical procedures on people with respiratory illness, and of course for other things that we need respirators for example, people with tuberculosis. There was a whole protocol and a shift, and we needed people to become comfortable and to understand how to care for people. At that time, there was a lot of anxiety and fear in my colleagues and all of us. We were watching what was happening in places like northern Italy, for example, and then again in Washington State, in New York. And so there was a lot of concern. I think we are in a much better place now. We have a protocol. People are more comfortable. We have experience caring for people safely with COVID-19. So those are the things that we are going to bring with us as we move into this next phase, both of the restart, but also as we go into the fall.
Thank you. The next question is from Shannon Waters, BC Today.
Hi, just kind of following up on that question. With the health minister's update for all the PPE items acquired, I just wanted to ask if that has changed the stage that the PPE pandemic allocation framework was at. We've been at stage 4, as far as I'm aware, for months now, and I'm wondering if that has moved the needle at all. Also, given your mention around starting to look at domestic production options, given that international supply lines have been challenged during this time, is the province planning on directing any funding towards helping local manufacturers who might be interested in making that transition the way that other provincial governments have done?
I'll let you take it.
Well, I think the situation is clearly better if you see the numbers. So I think the steps we've taken to ensure the proper usage of PPE, working with our healthcare workers and working with people in the system, have been effective in that regard. I think we clearly have to learn the lessons, and you're seeing that the volume of purchases we've made and the prudence we've shown with those purchases, the assurance that people have that they've been tested, our decision to bring in equipment into British Columbia to allow us to test respirators from sources that we have not received them from before, for example. These are important steps to both build confidence in the system and ensure that we continue to be prepared. And yes, we're working with the federal government on issues around PPE. You'll know that the Prime Minister and others have expressed a strong interest in that question. I know a lot of people have locally, in terms of the need to ensure, given what happened to supply chains in this case, that we take those actions to prepare, and we're working with other jurisdictions to see that happens.
Ethan Sawyer.
I was just going to say we are at the same phase right now, and that's basically because we want to continue to be cautious as we're restarting and more people are back in the healthcare system. We will look at that as on an ongoing basis, whether we need to change that or not.
Thank you. Next question is from Ethan Sawyer, CBC.
Hi there. Questions for Dr. Henry, but also hoping to get the answer in French as well. You mentioned yesterday an outbreak at a fast food restaurant. Just wondering if you can give us more details on that, such as the restaurant, how many people were affected, and whether it was just staff or customers were also affected.
Yeah, so as we've opened up different workplaces, we have seen people having more contact in their workplace, and we've seen that in a number of different settings. I'm not going to say the name of the restaurant because it's a small one, but it's not the situation is similar to what we've seen in other places where somebody doesn't recognize that they have symptoms, milder symptoms, and they may not have the appropriate spacing or barriers in place in the workplace, and there was transmission between 4 or 5 of the staff in that facility. I'm not aware that there was a customer who were exposed in that situation. I do know that our public health team of inspectors, public health inspectors, our environmental health officers went in and did a full review of the plan and the infection control precautions that need to be in place in every setting. And this is where it goes again to the foundations of how we safely open up. So I use that as a representation of some of the situations that we're seeing now. We saw it in the poultry plants. We've seen it in a number of other workplaces, the fruit processing plants. And if we catch it early, we can contain it very quickly. And this is just a wake-up call to remind people that we need to look at these situations, and we can become complacent with our workmates. And we need to be careful about that as well, because we are bringing our contacts and our risk from our contacts with us into the workplace. And if we don't take the same precautions with our workmates, we can pass it on to them, and they can pass it on to their families, and then it can be passed on to situations where people are more vulnerable, like our long-term care homes. Oh, en français.
Ça va être difficile. Juste pour dire que je pense que ce qui s'est passé sur le restaurant représente un réveil en quelque sorte pour tout le monde. C'est-à-dire que c'était une situation où des gens qui étaient proches a vu la transmission de COVID-19 et je pense que ce qu'il faut faire, le travail de l'autorité de santé de la région de santé était excellent dans les circonstances. On est allé intervenir à fond dans l'exercice pour assurer que tout le monde, toutes les autres étaient bien, mais quand même, cela représente un exemple de la nécessité de la prudence dans la matière et je pense qu'on a pris ces actions, mais cela démontre quand on ouvre l'économie, quand on ouvre vers plus de monde, quand on est en train d'ouvrir nos propres relations dans la société. Il faut que tout le monde soit prudent dans ces circonstances parce que COVID-19 est très difficile de maintenir dans des circonstances où des gens ne suivent pas des règlements. Donc, c'est essentiel qu'on suit des règlements et ceci est un exemple de ce qui peut se passer, peut se dérouler quand on ne suit pas ou on a un problème.
Marcella Bernardo, News 1130.
Hi, thank you, Dr. Henry and Health Minister Dix. My question is, what concerns do you have about this latest outbreak in Beijing that appears to be stronger than the first one and a couple of new cases now discovered in New Zealand as well?
Yes, so I know I was kind of hoping that, if we were an island like New Zealand, but it just goes to show what we have been saying all along, that once this virus is anywhere, it's a risk everywhere. And in New Zealand, they were, I understand, international travelers who tested positive on arrival in New Zealand. So we all need to continue to be aware that this is going to be in our communities for some time. Same with what's happening in Beijing. I've certainly been watching that very carefully. Again, associated probably with transmission in a market. And, we'll get some more information about that over time. The genomics will help a little bit. There's not been any outbreaks that we've known to be the source be a food product, but we know that it's people that are associated with those food products that pass it on to each other. And if it's not caught early, again, we need to be really careful about that. So that's part of our whole strategy right now here in BC. We've managed to flatten our curve, but we cannot get rid of this virus when we still have people who are moving back and forth and bringing the risk that they have with them, not intentionally, of course, but because this virus is in many different places around the world. So we need to minimize the numbers of cases that we see anywhere here in BC, and that's part of our focus right now. And in public health, we need to manage every single case to make sure that we don't get these super spreader events. And some of them we can control, some of them we can't. We can't, some individuals may shed a lot more virus than others for reasons that we don't know. But what we can control is those environments that are riskier. And we can control the numbers of people that we're in those environments with. And that's where the important measures that we're putting in place in our workplaces become so key, so that we're not inadvertently spreading it in those settings. That's where the measures that we have in long-term care homes, where we know there's such a vulnerable population. And then in public health, we are working very quickly and carefully to make sure that we're tracking every single person. And that's one of the reasons why we are continuing to have that reduction in numbers of people who gather, because that allows us to find people quickly and contain the spread. And we need to modify our activities as we're going through this to make sure that we can stop explosive outbreaks and rapidly progressing outbreaks. And so we're watching again very carefully in what's happening in China, particularly right now in Beijing. Also in a number of the states in the U.S. where we're starting to see more worrisome symptoms like hospitalizations. And we know that that's what we call a lag indicator. It means that enough people have gotten sick with this that some people are getting really sick with it and ending up in hospital. And that's what we need to avoid. And we think with the things that we're doing, the foundations that we have here, that we've all sort of learned over this transition, that we can keep it at a minimum level and prevent those super spreading events and explosive outbreaks.
The next question is from Shannon Patterson, CTV.
Henry, as you know, Stanley Park has been closed to vehicle traffic to allow walkers to use both pedestrian and cycling lanes of the seawall and bikes to use the park roads. In light of what we know now about the low risk of outdoor transmission and our low COVID numbers, do you think that needs to continue, or could the city now safely reopen the Stanley Park seawall to the same configuration as it was before the pandemic?
I actually think it's a really good thing, not just for the pandemic, but it encourages active transportation, getting people out there moving. Some of the things that have affected us most over the last few months have been that inability to get out and to experience things. So this is a way for more people to be able to use the park safely, and I would be in favor, personally, of keeping it that way, and reducing the numbers of cars we have in our roads and making our cities more amenable to active transport.
Thank you. The next question is from Glenn Korstrom, Business in Vancouver. Go ahead, please.
All right, well, at least I got an answer.
Dr. Henry, I'm just wondering about outbreaks in offices. You mentioned a while ago about the New World Technologies and the Maersk distribution Canada. Just want to confirm, those are still the only ones in offices, right? And do you have any numbers of people, or was it cubicles, or do we know how those cases came about?
Yeah, those are both still small clusters of cases, and again, it's very similar. As have more people are going back into those environments, and they're having more contact in those enclosed spaces. And yes, it was people within the office part of both of those situations. I don't have the numbers right off my head, but I know there have not been new cases in the last little while. So I'm sure they will be looking at declaring those over very soon. We wait 2 incubation periods to be certain that there's not somebody that's missed. But they are like the fast food restaurant, like the family, large family gatherings, those and a church setting that we've had a cluster of cases associated with as well. Those are cautionary tales to us that this virus is unfortunately still out there. So those measures that we are taking, the foundations that we have of our safe distancing, of our hand hygiene, of staying away absolutely if we're feeling unwell ourselves, and being really sensitive about that is incredibly important, and will continue to be for the next months until we have a way to control this virus.
The next question is from Nick Johansson, Castanet News.
Hi, Dr. Henry. Just looking for some clarity about the number of active cases in the Interior Health region. I see on the COVID dashboard that it's still saying there's been 196 total cases in the IH region. I understand that number was corrected yesterday. The dashboard is saying there's 1 hospitalization. Just looking for some clarity on what the reality of all that is.
Yeah, well, it's actually about the same thing. There is 1 person hospitalized, but they have met that criteria of being at the end of their active infectious phase. So they are technically also somebody who's recovered from COVID. Yeah. They did have a false positive that was removed from the data last week. Yeah.
Lisa Cordasco, CHLY.
Good afternoon, Dr. Henry. I wanted to ask a little bit about contact tracing, like that fast food restaurant. How would it be even possible for your people to do contact tracing in a situation like that? And so wouldn't it be maybe prudent to, even if there was a notification on the door to that restaurant about a possible outbreak?
Okay. So what we do, contact tracing is our bread and butter in public health around communicable disease outbreaks. And so we were able to determine exactly who had contact with who and who had protected contact with others. So the assessment was done of risk of the customers to the people in the environment, and it was felt that there was not a risk. So there was notification done of those who were known to be at risk, and these are the things that we do on an ongoing basis around trying to determine who passed what to whom and who needs to be in isolation through an incubation period. So that's the work that the contact tracers do in public health.
Thank you. The next question is from Richard Zussman, Global News.
Dr. Henry, I'm wondering if you have any update from Public Health in Ottawa around the letter you sent about Vancouver as a hub city and whether there's any update on that. And also to something you mentioned in your opening remarks, you mentioned choirs. Is there advice on whether musical groups can gather? And if it's not indoors, is there any encouragement about the way that choirs or other musical groups can gather at this time?
Yeah, so I did mention choirs, and I'll talk about that first, mostly because there's been a number of very serious outbreaks around the world that have been related to choirs or singing, and one of them was recently published, and there's been quite a bit of media about it in Washington State, where unfortunately a choir group of about 60 people, and 2/3 of them became infected, and they had a number of deaths. So it is a cautionary tale. We're seeing it as well in places like South Korea, where in nightclubs where people are singing and dancing or talking loudly in an area where there's enclosed environment and lots of people. So those are riskier environments. Right now, the BC CDC is working on an evidence paper around things like musical groups, bands, and choirs, and we will be coming out with advice on that. But right now, it's a caution to people that this is not the time to be having your choir practice, and to be very cautious. We know in Germany, even though there was supposed to be distancing in a church, there was singing, and this led to over 107 people being infected, and again, a number of people in that close community who passed away from COVID-19. So it is another caution that we still have this circulating in our community, so we need to be careful. In terms of the NHL, so the proposal for the hub city model has gone into the NHL, and so it's at the point now where and part of my response, having reviewed the protocols, was to confirm that it exceeded our requirements for ensuring that we had absolutely protected our communities, and that the measures that they were proposing were considerably above what our requirements were for preventing any risk to our community here. So that has gone forward. I understand to the NHL. I don't know when they're going to make their decision, but we heard it was in the coming weeks.
Thank you. The next question is from Scott Cunningham, CTV News. Scott, go ahead, please.
Dr. Henry. Dr. Henry, a recent study from the Agri-Foods Analytics Lab at Dalhousie has found that BC had the highest level of people still who intend to avoid restaurants as we move forward. Now, a researcher even said that BC has the highest fear factor in Canada. I mean, maybe that's been successful as far as the spread. The buy-in here has been huge. But as things ease up this summer, do you think your involvement in announcements about reopening and the economy could actually confuse people who see you as the person who's been so successful in this? Do you think maybe someone else should be talking about phase 3 or the economy reopening because you've been so successful?
Yeah. Once you scare people, it's hard to unscare them. Is that what you're asking? I will say off the bat that I am not the one talking about the economy, and that is not my area of expertise. My area of expertise is to provide you advice on the things that are riskier and the things that are safer, and the things that we need to do as the government restarts our economy and as our businesses work together. And we're here to support businesses in putting in place the measures they need. And I think we all have had a scare, if you will, around this virus. We've learned a lot about how it can be transmitted. We've learned a lot about the things that we can do to protect ourselves and our families. And we've seen many cautionary tales where we don't get it right. And for the most part, we can handle that. And that's what we're saying here. You know, we will see some transmission in our communities, but if we keep doing the things that we're doing, we can go back to doing some of the things that we did in a much more limited and controlled way, and we can handle it. when kids went back to in-classroom schooling, there was a lot of concern about what if somebody gets sick? And it's like, okay, well, we know how this manifests in children. We know the things that we can do to protect ourselves, and we'll be there to support you, to support the school community if something happened. So far, we've been lucky that way, and that's good. But that's the same thing in our communities. And, I'm enjoying going back to restaurants, and we just need to do it in a slow and thoughtful manner, and I think we've been doing that here in BC. So I don't think we have a higher level of fear anymore. I think we're just being cautious and not being complacent, and that, to me, is a good thing.
Just to say, there's been a number of polls taken about questions such as this: who's responding, who's following physical distancing, who's not, and I don't think that there's really a consistent pattern to the results. So I'm not sure that necessarily accept the premise of the question. What I can say is that the performance and the job of Dr. Henry in communicating what people need to do, having fewer rules here in BC, but a real effort to follow those rules that everybody made in society has been really a key element of the pandemic response. And when Dr. Henry presents the modeling next Monday, as she's done in the past, you'll see the impact of what people did, how they helped one another, how they saved lives in the community. So I think British Columbians can be very proud of that. We, throughout the process, didn't shut down elements of the economy, if you will, that other jurisdictions did. And so we've taken a calm, measured approach throughout. And I just think that people in BC want to continue to hear from Dr. Henry because her leadership has been exceptional.
And we have time for one more question today. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Office's orders, visit gov.bc.ca/PHO guidance. Our last question today is from Mark Antoine, Radio Canada. Mark, go ahead, please.
Hi, Dr. Henry. I know you touched on that yesterday, the mass gatherings and no more than 50 people, but regarding the theaters, are you giving any consideration to the idea of eventually lifting the 50 people capacity in theaters so that they can accommodate larger crowds safely? For example, the Queen of the Theatre has a capacity of almost 3,000 people. So there would be, I guess, some room to safely host those, more than 50 people, even in the lobby, perhaps. So is there any plans there or any conversations happening with the entertainment industry? Well, especially theaters, and if we can have a comment in French, please.
Okay. The short answer is there's ongoing work with theaters about how to open safely and the measures they need to have in place. And if there are different venues where you can have people going in and not mingling in one large crowd, those are measures that if we look at schools, for example, that they can take. And a very similar approach would apply in a cluster of theaters, if you will. But there needs to be, there's no thought for changing that 50 number for a whole variety of reasons, but most of which is because when we have people inside in a small space together, that's a riskier environment, especially over a period of time, and it's at the capacity of how we can effectively and efficiently contact trace when we have people in those environments. I will say that there is guidance coming that is being worked on with the industry and WorkSafe BC and BCCDC for a number of different, as we're moving into the transition part, and we have our foundation and we're moving into opening up other sectors. Those guidance has been worked on, and some of them we've heard of already, and some of them will be coming in the next weeks.
Oui, il y a des discussions avec le monde des théâtres, bien entendu, sur beaucoup de questions, mais ce qui reste le même, je pense, qui ne va pas changer dans les prochains mois, semble-t-il, je pense que c'est la limite de 50 personnes. Je ne m'attends pas du tout à un changement de ce règlement qui est fondamental à notre réponse à la COVID-19. Donc, je pense que la chose fondamentale ne va pas changer, mais il y a bien entendu des discussions pour qu'on puisse essayer, dans ces circonstances, sous ce régime actuel, pour que des gens puissent commencer encore à faire du théâtre, qui est quand même quelque chose d'important dans notre société. Avec cela, thank you very much, and until the next time, until Thursday.
All right, thank you for listening today, and I hope that we all stay safe out there, and we follow the directions led by the scientists like Dr. Bonnie Henry, Dr. Tedros of the WHO, and we'll get through this pandemic together, and we'll get through it safely. So, bye for now. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.